Hello, everybody. It's a great pleasure to join you at your virtual conference. Unfortunately, I have to do it virtually, but I'm very happy to be with you, even using this pre-recorded approach, because up to now I have given this presentation from the chest perspective to neurologists, but the other way around, really to introduce our concepts to chess experts. I think that is the other way around, and I would like to try to introduce you a little bit in our medical concepts around multiple sclerosis. So I'm Tjalf Ziemssen, I'm a neurologist, I'm heading the Center of Clinical Neuroscience, which is based in Dresden. So we have various institutions as part of the Center of Clinical Neuroscience. So I would like to talk about multiple sclerosis, which is a disease, neurological disease we are very much interested in. Here you can see the landscape of Dresden. Here you can see where we are based in Saxony, so the capital of Saxony is Dresden. And there we are taking care of a significant MS population. So multiple sclerosis is a quite common neurological disease. It's a disease where the own immune system attacks structures inside the brain and spinal cord. Because this can happen at any place in the brain, it can cause a variety of different symptoms. We call it the disease of 1,000 faces. It's usually the disease of young adults, mostly female. And the very special thing is that MS usually is not responsible for reduced lifespan. So if you have been diagnosed with disease, you have to stay with this disease for your whole life, and that's why it's very important, especially if we can change the outcome of this disease, which untreated at the end leads to increased disabilities, so you cannot walk anymore. You have other functional disabilities which you can develop. Here you can see a little bit what happens. So the immune system attacks the central nervous system, and this is resulting, as you can see on the right side, in a variety of different symptoms, usually balance, coordination, motor problems, visual problems, speech, fatigue, depression, cognitive disorder. So that is very common. Yeah, so it was a disease which where it started around 20 years ago to have treatments available. So we have a significant development. So we neurologists, we have been by history, we have been very experienced with high quality diagnostic workup. But for a lot of neurological diseases, we still do not have therapeutic approaches, and that's why we are very lucky in the MS field that we can change the fate of our patients. And you can see here the development in the past years that we have different treatments available. But now I think the challenge for us is, as we have now around 20 different treatments available, which one we should select. It's like going to the supermarket and I'm not a fan of jam, to select the right jam. And of course we have a lot of clinical trials in our field, but usually if you read the pivotal clinical trials which lead to approval of drugs very well, I think it's not possible to treat the individual patient sitting in front of you. And I think that's now adding a significant complexity what we have to do in the case of our multiple sclerosis patients. So years ago we had only 2 different treatments, and there of course our strategy was quite simple. But now with a lot of different treatments available, of course with treatments focusing on the immune system, which are more aggressive, which are less aggressive, I usually make the comparison with the chess game, because in chess I think you have the same phenomenon. You have different, of course, players, and you have to develop a strategy which could be helpful. And that's now the analogy why in the MS field we have to learn from chess, because a lot of rules which you follow should be applied into the neurological care of MS patient, because that can help us a lot. Yeah, and you know very well that chess opening is clue. Yeah, so if you are sleepy, or if you don't have a strategy from the beginning on, I think it's very bad. And here you can see all the literature, only a selection of literature, which is based on chess opening. And the same is true in a disease like multiple sclerosis. So especially in the early time, so there the important decisions are made. So especially looking at the early phase of disease, in this time, most of the destruction in the brain takes place. The big problem is for us as neurologists that this slogan "time is brain." So really, if it takes us for a long time to diagnose multiple sclerosis, if it takes too long, then of course a lot of neurodegeneration takes place, and you can see here some schemes really demonstrating us what does it mean if you are too late. And I think it's the same with chess. If you start chess playing your right chess strategy, starting with the 5th or with the 10th move, I think it's too late. Yeah, and that's for us very important. So the MS opening, in analogy to the chess opening, it's very clear. So to develop strategies, to diagnose, not to develop delays, and even if you have an intervention, not to wait too long, because a later intervention, which is delayed, like starting playing the right chess at a later time point, you can see that the disability which will develop is significant. And that is a little bit what we have. So we have, for example, we have treatments which are less effective, and then we have treatment which are stronger. On the other side, of course, the adverse events which are associated are there, and that's a little bit like a strategy, and that's you can see it from our paper on the left side. So we have first line and second line, like you have in chess, but you have to find the right mixture, and you have to react in the right way towards a strategic multiple sclerosis treatment. But it's not only at the beginning. So if we recognize that, for example, one treatment strategy does not work, we have to react, and we have to move to a second strategy. And in our disease, so we have several so-called window of opportunity where we can respond to certain treatment approaches. And I think here it's very important not to be too late for this window, for this early treatment window, and then for this early treatment optimization window. It's like in chess. If you're not concentrated, if you don't follow your strategy, you are lost. And what is lost, I think it's very, very difficult to be regained. Our problem in MS is that the young brain, which is affected by multiple sclerosis, usually has a significant brain reserve, because there's a lot of compensation. Usually, if you destroy a lot of your brain by inflammatory lesions, like in multiple sclerosis, you don't see the functional effect very soon, because we have, as you can see here, we have this brain reserve. So the green curve, of course, it's reduced over time, but this brain reserve is responsible that you don't see really the result. And it's a little bit like in chess. So if you start with little mistakes, in your strategy, so it's not visible there, but the consequence at later stages of your game is significant, and that's why we have to focus really to early strategy, not be too late, because the consequences what we have done are visible late. But at that time, we don't have really means to reverse multiple sclerosis. So we cannot regenerate at this time point. So all brain cells which are lost, all neurons which are lost, cannot be regained, and that's of course a significant problem. And of course, we have a lot of factors influencing our strategy. Age, then of course a lot of parameters. It's like in chess. So the factors which affect your strategy in the game are multiple, and that's the same for us. So each patient, each game is individual, and we have to look for it. On the other side, we know it's very important in chess that you have a pattern recognition, so that you have, if you're inside a game, you can recognize so what is going on. And here you can see all the literature which is about pattern recognition. Same is true in multiple sclerosis. So to give you an example from another discipline, from oncology, 60 years ago, looking at cancers of the blood, so leukemia and lymphoma. So at this time period, we had no differentiation, so no pattern have been identified. At that time point, you can see the 5-year survival time of these cancers was about 0%. Now we have, of course, by different patterns, we can recognize a lot of different leukemias, and you can see by this pattern recognition, we are more successful, for example, in treating this tumors of the blood, so leukemias and lymphoma, and same is true for multiple sclerosis. Because here, for example, to give you an example, that are 100 patients, and if 100 patients are treated with a drug which is partially effective, so we don't have, in medicine, we don't have drugs which are 100% effective. But what is now the pattern recognition we have to show? So if we look for the individual outcomes of our patients, so we treat them all with a drug, and if we look then what happens to them in the next year, in the next 2 years, so you can see that we have 20% responders, so 20% are doing well with their drug. But we see that 40% are suboptimal responder, so they're doing clinical well, but if we do imaging of the brain, we can see that disease is progressing, and we see that 40% are completely non-responders, so they tend to have signs, relapses, because they present with inflammation in the brain. And this has to be recognized, and it's like we have here again from our paper, so there has to be circles, we have to re-evaluate the new position, the needs of the new position, then we have to achieve the objectives, and then we have to find and compare feasible moves, and then again, so we have to come up. And in the field of multiple sclerosis, of course, we have different variables we have to look at it. Of course, on the one side, we have to look at the patient symptoms. So are there problems which are significantly worse in comparison to the time 1 year ago? Then we have imaging. We can ask the patient. We can do specific tests. So this pattern recognition, it's quite complex in MS, but it's not standard and has to be implemented. And I think it's like our attitude in chess. So if you have no pattern recognition, it's very difficult to develop in an ongoing game new strategies, and same is true for the field of multiple sclerosis. That's why for us it's so important that we make the disease measurable. So here you can see the famous sentences of Galileo Galilei or Lord Kelvin, and that's why we have developed our approach to collect really multidimensional parameters, because then I will come here in a quite nice analogy with chess computers. We can use then modern technology to of course improve our treatment of the patient. Because what we would like to have is we have different treatment approaches, different strategies available, but we would like to have the best individual treatment option for the patient sitting in front of us. So after we have made a big achievement to have treatments available, we have now to personalize treatment. It's now again important what Hippocrates, a good old physician from old Greece, told us. It's more important which patient has a disease and which disease the patient has, to be really personalized. And for this approach, it's very important. There's a very nice analogy again with chess. We have to go to big databases. So the specialists in the chess field, of course, they learn from other games. So what has happened, what are solutions there, and that's why you have big databases with all moves in the last 20 years. And the same is true for us in the field of MS. We try to collect data, high quality data. We call it in medicine, we call it real world data, because this data, data from clinical trials, they are so artificial. We have to go in the clinical practice, collect this data. And the advantage is that by using this big data approach, so not having your experience with your 100 patients being in your office, but to have really the experience from all of the patients which are documented in the system, we can go to an individualized treatment approach. And that's a little bit shown on the right side. So we try to profile our patients by pattern recognition, like you do in the chess match, and then by comparing it then with databases. So what is the situation when certain drug is very efficient? We can go then for the individualized treatment, and that's why we need lots of data to improve the individual treatment of our patients. Yeah, and you know very well. So of course we would like to play human chess, but we have of course to talk about Deep Blue, which was one of the first chess computers. So here you can see the algorithms from the past, and of course these are very efficient ways. And of course in medicine we are very interested to be assisted by such strategies. But of course I think it's like in the field of chess, and that you can see here that modern technology like artificial intelligence, which is now used, for example, in your field, for example, to identify unique styles of players. Of course, it's a challenge for multiple sclerosis, for the management as well, but it gives a lot of perspectives in this field. And I think when preparing the talk, I have to say that probably the challenges and of course the benefits are of course both with this new technology, but especially I think in the field of medicine it's very good that we have these approaches and we can hopefully use it. Nevertheless, we would like to keep of course the individual contact with our patients. So I think it's like this bias in the field of chess game. I would like to show you at the end a little bit what is our direction, what we develop, and how we can use, for example, digital technology to improve the outcomes of our patients. So we use the concepts of digital twins. So digital twins is a concept in industry. It's a virtual model of a product, process, system, or facility, and the data collected there are analyzed by artificial intelligence, and that's why, for example, the car production or the energy production, a power plant, can be optimized and can be adapted. And that's what we are doing by collecting data and procedural data, so clinical parameters, paraclinical parameters, and procedures. So we have a virtual twin of our patient, so which contains all the data where it can be used by the treating neurologist, it can be used by the patient himself to look at it, to have a dashboard, so not a very boring physician's letter, which contains a lot of text but not visual information. And in this context, I think you can see that digitalization can help us to be a better, to develop a better strategy, like which we know from the game chess. Yeah, and that is a little bit a look in the future. On the other side, as you can see in this cartoon, it will not mark the end of the neurologist, yeah, but it will increase quality and outcomes, and that's the same, I think, in the chess arena. So that digital technology is of course a challenge, but I think to use it in the right way, I think it can help. You can probably improve your habits playing chess, and that's why I think by having this analogy to be a good MS chess player, and on the other side by using new technological approaches, I think we can reach our ultimate game, and that is of course that at some time we will have checkmate for multiple sclerosis. So this was my talk demonstrating that strategic approaches are very important in chess and in multiple sclerosis management as well. And by using these analogies, I think both sides could learn a lot. I would like to thank my team. Here you can see our center with this very nice cartoons in Dresden. That here are my colleagues working hard to improve MS management. Yeah, and here you have the contact details, so don't hesitate to contact me, and I hope to meet you at one of your next conferences. Thank you a lot.